When most people hear the word dermatologist, they think acne, Botox, or maybe that one weird mole they've been meaning to get checked. But dermatology is so much more than skin deep. In today's episode, we're pulling back the curtain on what dermatologists actually do. From diagnosing life-threatening skin cancers to helping patients feel confident in their skin again through cosmetic treatments. We'll break down the difference between medical and cosmetic dermatology and introduce you to the two physicians leading our practice, Dr. Rostan with a specialty in cosmetic dermatology and Dr. McLean, whose passion lies in medical dermatology. You'll hear how our backgrounds shape the care we provide and why you might want to rethink what you expect from your next dermatology visit. Whether you're coming in for a skin check, a rash, or a refresh, this episode will help you understand the science, the strategy, and the art behind healthy, beautiful skin. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. And to start with, Dr. McLean, why don't you tell our audience what a dermatologist does?
So a dermatologist is a medical doctor who specializes in diagnosing and treating conditions of the skin, the hair, and the nails. So they are physicians who have been to medical school and have completed at least 4 years of training after medical school to become a dermatologist.
Excellent. Well, I think I can speak on kind of the difference between medical dermatology and cosmetic dermatology. When I started this practice in 2001, for most of the 20 years, I did both. And I think doing both is really important. You've got that expertise of the skin, hair, nails, and taking care of patients combined with what I have honed as cosmetic dermatology skills. I trained in a fellowship in laser and cosmetic surgery, which included lasers, but other things as well. But with that combination, it's just fantastic. We can grab different things to help people with acne. We can use medical treatments. We can send them downstairs to see the esthetician, laser treatments to help with their acne scarring. And for me, skin beauty is equivalent to skin health, and I think you agree. And it's nice when we can help patients in both aspects.
Absolutely. I think sometimes the line between medical dermatology and cosmetic is very blurry because a lot of times when we treat a skin condition, say acne or rosacea, from a medical perspective, of course, there are cosmetic benefits. And sometimes our treatment recommendations, even on the more medical side, involve what you may consider more cosmetic treatment. So, for example, oftentimes, especially at our practice, a patient may come in for treatment of rosacea, which is, a red color on the cheeks, sometimes with acne-type bumps as well. And we treat it either with topical medicines, sometimes oral medicines, but we often also recommend those cosmetic treatments like lasers and really aim to give our patients the best of both worlds here.
Yeah, you have to be creative about it and really pull from everything. That's what we consider comprehensive care, that we've started calling the art of medicine and the science of beauty, putting them both together. And we're so excited to have Dr. McLean at our practice. She really brings a level of expertise, and I've been known to say she's way smarter than me. So if you were just ever wondering who to go see, you can trust Dr. McLean. But Dr. McLean, would you tell us a little bit about how you got here and your background and your training?
Yeah, sure. So it was a winding road. So I grew up wanting to become a doctor, but I took many detours. So I ended up completing all of my pre-med curriculum at Wellesley College, which is where I completed my undergrad up in Massachusetts. But I actually worked here in Charlotte for Bank of America right out of college. That was my very first job, right in corporate center.
Who would have known?
I know. So my first job was right in corporate center, just down the street. But that little voice inside my head eventually would not shut up. And I had to take the MCAT. I studied after work. And at that time, I was actually in London. But fortunately, I did get accepted to medical school down in New Orleans at Tulane. So that's where I completed medical school. And after medical school, I did my intern year in internal medicine and also my dermatology residency training at Boston University in Boston. And after that, I moved to Charlotte, and I've been practicing ever since here.
Excellent. And I can tell you Dr. McLean has a wide following of very happy patients.
No, well, you're very sweet,
Thank
Dr.
you.
Rostan. Thank you, as do you.
Well, thank you. Well, let me tell you a little bit about my background, how I got here. Anyone who knows me, I have a love for animals, tons of dogs and one horse. So I always wanted to be a vet. But I kind of had some opportunities in high school to work with physicians, and I wanted to be a physician. So I went to school, pre-med, did not alter from that route, and I did school at University of North Carolina, Chapel Hill, go Tar Heels, and then proceeded right into medical school at the University of North Carolina, Chapel Hill. And really early on, with one of our first lectures, they say med school is like drinking water from a fire hydrant. So it all happened in a blur. It was an immunology lecture by Dr. Al Brigham, who was chair of the dermatology department at UNC, and he's a lovable guy. He unfortunately is deceased now. He died several years ago. But I was kind of hooked. I'm like, this is fascinating. I didn't know this was skin and dermatology. Mm-hmm. All this immune responses relating to the skin that you can see. It's external. And I was interested in other things throughout med school, but I kept going back to dermatology. So sat down with Dr. Brigham right before my fourth year of medical school, and he said, I think you'd make a great dermatologist. I think you should go for it. Did my dermatology training at Duke University after an internship in Emory University in Atlanta. And at Duke, I got interested in surgery, but really didn't find a spot for the specialty called Mohs, which is skin cancer surgery, and had an opportunity to meet Richard Fitzpatrick, laser expert, kind of the grandfather of lasers, modern laser surgery, and did a month fellowship at his practice, just a little extracurricular. You were given 3 or 4 weeks. And Dr. Fitz, as everybody calls him, Fitz said, why don't you come here and do a fellowship next year? And so I uprooted my husband and dogs, and we went to San Diego. During that training, it's a lot different than now. Lots of lasers. I learned, actually learned hair transplant, but I don't do that. Sclerotherapy from Mitch Goldman, liposuction from Kim Butterwick. But what I learned was the skills, the aesthetic skills, to put it all together with ongoing training. Came back to Charlotte in 2001. Really couldn't find a practice that wanted to buy 5 lasers. Imagine that. So I started my own practice, and it's evolved, but I've always valued the combination of medical with the cosmetic. Now that I'm in the twilight of my career, I only focus on cosmetic, and that's my primary interest, and have developed an expertise in injectables that didn't exist when I started this process.
So, Dr. Rostan, one thing that I think is unique about dermatologists is that we do have that broader medical background. I would love to hear your thoughts on how maybe your intern year at Emory, where you weren't practicing dermatology, has impacted your practice.
Well, yeah, that's a really good question. And unfortunately, for anyone with a medical emergency, those skills that I learned there have long left me. But I used to joke that anyone could drop dead in front of me and I wouldn't flinch. I'd just start working on them. We were just trained in the moment. It was an inner city hospital, ER, I don't know, 16 floors. It reminded me of that TV show. I don't watch TV, the hospital show. It's like that. The whole upper level was this barracks where if you were lucky enough, you could go up and nap. But, and I keep learning from Dr. McLean because she does this too, having that medical background, we think. Mm-hmm. I just saw someone the other day with freckles on her lips. And I thought, gosh, are these just freckles? Or is it Pooch Jaeger underneath? Connecting the medical, having someone with a chest rash. And I'm like, are you having difficulty raising things above your head, digging deeper below that layer? And sometimes patients are surprised when we ask these questions and can direct them to the right physician. So I think having that medical background and keeping that radar going in our head, not trusting. The thing is with dermatologists, we look and we go, boom, that's what it is. But the back of our head going, is that really what it is?
And it takes a lot of training to get to the point where you can say, boom, I know what that is.
Yeah, that's right. Sometimes people are like, you just spent 5 minutes with me.
Yeah.
And
How
I'm
do
like,
you know?
Like, I know when I open the door, hi, Mrs. Smith, I'm going to biopsy that basal cell on you. I don't say that when I come in the door, but
Right.
the truth is we see it. And our PAs are strong at that. It blows me away. I'm going to brag on them a bit. Dr. McLean has diagnosed a melanotic melanoma this week, which is nearly impossible to diagnose. Another melanoma on the ear, which she almost didn't biopsy, but she's like, it's just my gut. Something's not right about this. Our new PA, Alexis, has training in Florida, and that girl is a hawk. She
Skin
biopsied
Cancer Central.
she biopsied something, and I was like, I don't know, maybe we could watch it, but it does look kind of funny. It was a basal cell. That instinct is honed by seeing a lot of people and drawing on our medical skills.
Right. So in residency for dermatology, I'm not sure if your program was set up similarly, but for my program, and I think a lot throughout the country, we end up rotating through different types of dermatology clinics. So I had training in pediatric dermatology, just bread and butter general derm, just whatever walks in the door. In my residency training, I was fortunate enough to have a dual clinic with our oncology program, where we would actually round on patients who had advanced cutaneous lymphomas as they were receiving their infusion therapy. So that was really rewarding. And then, as Dr. Rostan mentioned earlier, we also have surgery training. So part of dermatology is surgery. We are trained to remove skin cancers. There's different ways to do that. Some of them are more advanced procedures which require infrastructure and training that neither Dr. Rostan and I chose to pursue. But we do a lot of the more straightforward excisions here in clinics for basal cell, squamous cell melanoma. And we also remove benign lesions like cysts and lipomas. And I personally love that aspect of practice. One of the reasons I chose to go into dermatology is that I think it's the perfect mix of the cerebral thinking, problem-solving part of medicine, but we also get to use our hands, and we can cut out a skin cancer, and it's cured. I mean, there's not that many areas in medicine where you can get that instant gratification. It's very rewarding.
And we can do it right here in the clinic under local anesthesia, no OR fees, nothing like that, with most of them unless they're really big. We can also do unusual things. We can do eyelid biopsies. We can help people with eye problems involving the skin. I have pulled large pieces of glass out of individuals from a car accident, say 20 years earlier. You just kind of never know what's going to come in the door. And we've got the tools and the skills to dig below the surface enough to solve those problems for patients. And, I've been known to say in dermatology, we don't really cure anything.
Oh, but we do.
But we fix things and we find solutions. We are problem solvers. My father is an engineer, mechanical engineer, and I think it's just in my blood. I just roll up my sleeves and find a solution. And that's what we do here as dermatologists every day. One of our core values here is success. And what we mean is success for the practice, providing great service, success for the people that work here, but success for the patients and going the extra mile and not quitting until we've got a solution, drawing on whatever expertise we need to.
And I think that's one of the reasons I have enjoyed working here, Dr. Rostan, because I think you've really impressed that mindset on everyone who works here. And when we do have a challenging case, we're asking each other for help. Hey, how would you do this? What else would you add? So we really do try to leave no stone unturned so that we can best help our patients. Dr. Rostan, I'd love to hear just day to day. What's an average day like for you in clinic?
Oh, my day to day. So my day to day is peppered with different things, including injectables such as Botox and fillers. My filler appointments are 20 minutes long, but the patient is here longer because they come in and get cleaned up and photos, and I mull over the photos and look at them and make sure I'm providing the right care. We have cosmetic consultations, supervise the PAs, occasional medical dermatology in patients that I've had for a long time. And then running the business a lot too, taking care of everybody here in the business so they can roll their sleeves up and take care of all our patients' medical dermatology problems. I do dermatology laser procedures, the more invasive ones downstairs, but also supervise the laser specialists that are down here and talk to them about cases, help them get settings, analyze when maybe a treatment's not going the way we want, think about how we can tweak it or use another device to help them achieve their goal. I guess the most rewarding thing is seeing people meet their goals and keep their goals and look better throughout the years and healthier with just some minimal maintenance. And sometimes that's making an appropriate referral for them, using my expertise to say, I think this needs some plastic surgery. And that happens too. I said, you're going to need good skin for plastic surgery, so keep this up, and we'll take care of you from that direction. I know your day is hectic, and I know Dr. McLean loves seeing her patients, but what do you love most about seeing the patients and doing the things you do all day long?
You know, I really do feel like I have the world's best job. I can't think of a single profession I would enjoy more, and I think it's a combination of relationship building. Like you said earlier, sometimes we don't cure things, sometimes we do, but a lot of times what we are able to do is really improve a patient's quality of life and their overall health, and that is just incredibly rewarding to me. So when a patient comes back and they're better, it's just amazing, and they're happy. They leave with a pep in their step, and that translates to me. So I get a lot of energy from my patients, and if someone comes back and they aren't having the result we want, it's rewarding and a fun intellectual challenge to figure out what we're going to do next to try to get them better. So I like the fast-paced. I like relationship building. I love seeing patients of all ages. I could see a 2-week-old baby all the way to a patient in their 90s all on the same day. I get to see men. I get to see women. Just all comers come to dermatology, and that's another reason I chose it. I couldn't really narrow down to just one demographic. I like to be able to see everyone. And one thing I love, and I'm sure this has happened to you over your career, is when you might see one member of a family and then they end up sending their child to you or their parent or their spouse, and then you really get to know the whole family. So there's just so many things I love.
Oh, yeah. I mean, I've been doing this long enough that one of the kids, I took care of his acne as a teen. He's now a parent with 2 children that we see. So this has been a long time. I think what also is unique, and many people don't realize about dermatology, outside the fact that we take care of hair and nails as well, is sometimes I'll mention something to a patient, they didn't ask, swelling in their legs, for example. I'm like, that's a little venous stasis. I recommend this and this. And you know what? If you want those legs healthier, I can make a referral to a vein surgeon for you. And they're like, well, why? I'm here for a skin check. But it has to do with the whole health. Sometimes we see changes on the skin that might be indicative of glucose intolerance, early diabetes. And I think Dr. McLean and I both have changed tack a little bit. The primary care physicians are very busy. So I kind of say to the patient, you know what, have you had your A1C checked? Your glucose, that's a glucose measurement. I think we need to pursue this. I'd really like for you to follow up. People telling me they don't sleep well and their hair is thinning, and I look at their age. Have you talked to your doctor about the changes of menopause? I think I'd encourage that, and I talk to them about my perspective. I really encourage estrogen replacement, or at least having that conversation. Osteoporosis. So these things that come up all the time. I mean, I've diagnosed a melanoma and multiple basal cells just doing neuromuscular injection treatments. I'm like, okay, I'm happy to do that, but I do see this I'm worried about. Do you have someone to take care of you? And I think that can be surprising for patients. Sometimes they're taken aback. And sometimes I even gently bring up weight. Weight can cause skincare problems, and it just becomes full circle. And, we run out of time, but directing the patient to what they need, if we can at least do that.
Absolutely. I had an older gentleman recently who was jaundiced on his exam.
Oops.
And had no idea. So I ordered liver labs. They were abnormal, and he got in with his primary right away. So what we do is truly more than just skin
Correct.
deep.
And I know Dr. McLean can look at fingernails and say, I think it's time to visit your rheumatologist again.
Yeah. So, Dr. Rostan, cosmetic dermatology. What are you seeing now as the most popular cosmetic treatments that patients are coming in, maybe asking for, or that you're recommending?
Well, I think our most popular treatments still remain, I want my skin to look better. Everyone's well-versed in the neuromuscular relaxers, that relax line of muscle movement. But some of the things they may not be aware of when they come in and maybe they ask for some popular laser treatment they've heard about, I tell them, well, we kind of take a boutique approach, a customized approach, and do something particular for you, something that you need. But I share with them the knowledge that we have now that these rejuvenating procedures, while making your skin look beautiful, they make it healthier. We've learned that renewal on the surface helps with precancers and skin cancers, but it's more to it. It renews below the surface, a skin cell called a fibroblast that actually does a good job at policing our skin of bad cells. So now I try to empower the patient. I'm like, look, this is not just vanity. This is taking care of you, the health and the structure of your skin, as well as the beauty. And I feel real good about that. A lot of people are hesitant to say that they want correction, particularly women. A lot of women over the 60. I guess that was just the generation. They're like, no, you're supposed to age gracefully. And I said, that's fine. But to me, aging gracefully is using great skincare products, correcting sun damage, addressing some of the signs of aging so that your skin keeps up with you structurally and functionally, because I know you're taking care of you. Everyone is into prevention of bone loss and eating a healthy diet and taking care of themselves in terms of exercise. So it all kind of goes in there together.
It sounds like one of the things that you probably counsel on is realistic expectations. So you were saying that there's a population of patients who are almost afraid of cosmetic treatments because they don't want to look different or weird. And I do think that that's part of the education that we do, that if these treatments are done correctly, you're just going to look like yourself, but better.
Yeah, absolutely. And that's our goal. Actually, my goal is it looks like you had nothing done. So your friends just say, oh, you look great. I'm like, boom, we have done it. So I kind of laugh sometimes when they're like, I don't want too much. And I'm like, we're so far from that. But it takes trust. And both from a cosmetic side and a medical side, you've got to develop trust with the patient in showing them your expertise all across the board.
So, Dr. Rostan, there are constantly things coming out, new studies, new devices, new treatments, new brands of neuromodulators. How do you stay up to date? How do you choose what to bring into the practice?
That's a great question because we are bombarded. I tend to wait a little bit for the science and see what's going on. I go to meetings and learn about things. Dr. McLean and I went to a meeting in Hilton Head and learned quite a lot.
It's great.
And develop further what I've been exposed to at those meetings. I try it out on a few patients, and I really think, does this benefit my patients, and are they gaining anything if I bring this on board? It is a lot of work staying on top of things. I know you can attest to that in terms of medical. How do you stay on top of everything? I'm lost on medical now. I have to go to her because I think every other week we've got a new biologic or something.
It's overwhelming. So biologics are a class of medicine, usually injectable medications that have really exploded on the market in the last 10 to 15 years for dermatology. And we use them a lot now for conditions like atopic dermatitis, which is eczema, and psoriasis are the big two that we see the most often. And you're right, there are more and more all the time. We're getting new topicals. It's actually a really, really exciting time to be a dermatologist because our medications just keep getting more targeted and effective, but also safer for our patients. So we have things that used to, we would just kind of slap topical steroids on it for years, maybe some prednisone or an IM steroid injection. And now we have a whole plethora of options. I still use a lot of our older immunomodulator medicines. I was trained kind of right at that cusp where Dupixent, kind of our first big darling for eczema, came out in residency. But I used a lot of methotrexate, sometimes even phototherapy in residency. So it's always a mix of really making the right treatment decision for your patient based on what's available. And as far as staying up to date, I'm with you. I think conferences are helpful. We get journals. It's hard to read them all cover to cover, but I certainly try to flip through and read the abstracts and read the articles that are pertinent to my personal practice. One thing that we've started to do here is a weekly conference with our physician assistants. And that, I think you would probably agree, has been really rewarding for all of us, where we take the time to separate ourselves from the hustle and bustle of our clinic days to really sit down and review a certain topic in dermatology. So most recently, Dr. Rostan's been reviewing hair care management and how we evaluate and treat hair loss. We've also talked about different ways to treat skin cancers and psoriasis. So it's an ever-evolving process. I think when you commit to a career in medicine, you're committing yourself to be a lifelong learner. And one thing, just to maintain your board certification. So to continue to be able to use that designation that you earned of a board-certified dermatologist, you have to maintain continuing medical education credits. And we also have online quizzes through the American Board of Dermatology that we must complete quarterly, actually. So 4 times a year, we're logging into the American Board of Dermatology website and completing quizzes, essentially. And, it's one more ticky box thing to do, but I don't know about you. I actually have found those articles and quizzes helpful.
I'm geeky enough to enjoy that.
I do too.
I hate to admit it, but I am. And I enjoy our sessions with the physician assistants. I learn things, but I will share with our audience, we have exposure to online courses and resources through our professional societies that are not available to estheticians or people in a spa that think they're skincare experts. They do not have the access. Now, they have access to someone trying to sell them something, and that's called bias information. But what I've enjoyed about our new training modules here at Charlotte Skin and Laser, another one of our values is learning, ongoing learning and training of everyone. We share knowledge with the entire staff once a month at a staff meeting. We focus on a couple of topics, medical and cosmetic. We have chat boards where my poor staff is exposed to all this stuff that I read, and I post it. And I'm like, here, I found this. This is interesting, and look at this, and share cases. I encourage my PAs and my estheticians and my laser technicians to share the knowledge. If they have seen a webinar that they like, share laterally, share up. And that kind of dedication to a learning environment, I think, will be critical to our ongoing success, not just for us as a practice, but for our patients. That's where we dig deep and find the success.
So, Dr. Rostan, you've mentioned estheticians and laser specialists.
Yes.
Could you explain what that means at Charlotte Skin and Laser, how you bring people on, how you train them, and what they're qualified to do?
That's a great question. So we do have estheticians here, and they go through a training period outside the office, so they become certified estheticians. Here in the office, they start out training with our lead esthetician, Kirsten, and they start out with some of the basics and develop and move up the scale. They also spend time with us, Dr. McLean and myself, seeing cosmetic treatments and medical treatments. My laser staff goes through a very intensive 4 to 6 month training period gradually, where it includes didactics and homework and tests, and they learn procedures from the lead laser specialist and with me. All of this is supervised and documented and then run by me, and these poor laser staff, they have to answer my questions and do a treatment in front of me and typically on me. So when I say they're well trained, I mean it because I've seen it and I have directed it. But that is the level that we expect here. And they have ongoing training. I review and encourage them to seek help when they need it.
So how does it work? So if a patient is listening and would like to maybe get in for a facial or laser treatment, maybe some neuromodulator, where do they start?
Yeah, so typically it started by making a cosmetic consult appointment, either with myself, which is more comprehensive, typically someone who wants to talk about volume loss, skin laxity, maybe hair thinning, body wrinkles, and we develop a comprehensive plan. Or they can schedule a consultation with one of our laser specialists who can come up with a plan. And the laser specialist can also recognize, you know what, this needs a touch of Dr. Rostan. I'm going to take great pictures. I'm going to share with Dr. Rostan what I learned today. And so they can have a consultation with me without meeting me the first time. We do get a lot of referrals from the medical side, as we've discussed, the acne scars, the rosacea, pigment issues. All of those can be helped and assisted by things both the estheticians do as well as our laser care specialists. Dr. McLean, I think, I feel strongly about training and ongoing learning. What would you tell our audience about selecting a board-certified dermatologist or care directed under a board-certified dermatologist versus going to a med spa? My new saying is, I don't think you can throw a cat without hitting someone who says they're a med spa. Frankly, I don't think they're a med spa unless there's an MD there, the medical, but they are called med spas. What can you share with our audience about how to make that choice?
So, of course, I am biased, obviously, and think that any med spa that does not have a physician dermatologist on site is less ideal. And a few reasons why are that there are nuances to what we do. So, for example, there are some laser treatments that are not appropriate for certain skin types and certain conditions. So it is not one size fits all with laser. One thing you said earlier is that we take a boutique approach to our patients, and they may come in asking for a certain procedure by name, and that may or may not be the correct choice for them. And you really need to make sure that you're seeing a practice or a provider who has enough experience and training and direction to really advise you as a patient and not just give you maybe what you saw on Instagram.
Great point, Dr. McLean.
Yeah.
And we do see that a lot. I want a halo. And I'm like, it's just not good for you.
I mean, halo's great, but it's not for everyone, and it's not
Correct.
for every condition.
We can fine-tune laser treatments here for what you actually want.
Another reason is that every now and then complications do happen. So, of course, everyone in this industry, or at least I would hope, has a commitment to patient safety above really all else. But every now and then you may get bruising, you may have a vascular occlusion from filler, and you need to be in a place where they have the expertise to manage that complication. So that's a major reason for me. Laser burns can happen. Post-inflammatory hyperpigmentation from laser can happen if the correct settings aren't used or if it's used in the wrong condition. So I really do think having a dermatologist at least on site or do your procedures is the safest thing.
I agree. And I am open and honest with my patients about the more serious complications that can occur from injectable fillers. And usually I get a question of, have you ever seen it? And I say, yes, I have, but not caused by me. I have treated these complications where someone got it in a med spa without a physician supervisor, and actually let the patient leave with it unrecognized. So these things do happen. I wish they didn't. Maybe one day in the future it'll be 100% safe, but I can't guarantee that. And if you come to see me, that's exactly what I will tell you. So go to someone who does the training and is prepared to take care of you as a whole person, not just inject your filler and, oops, I don't know how to do anything else with you. You've got to go somewhere.
Yeah, I mean, one thing that I feel myself personally and have noticed in some of my dermatology colleagues is that we're almost scared or more conservative than maybe people who don't have as much training. So it's a little bit ironic sometimes.
Knowledge is power, but
Yes.
knowledge is also fear. Once you
Yes.
know, you have a healthy respect for what can go wrong.
Yes, because we've been talking about vascular occlusion. I mean, that can lead to blindness, stroke. So these are very, very serious things that fortunately are super rare, but God forbid there's any suspicion, you need to be able to manage it.
You know, Dr. McLean, one of the things that we've done recently that I really enjoy coming into work every day is we've hired young medical assistants. They're college graduates that wish to go on and pursue a career in medicine. I've just enjoyed working with them. I think you have too. Can you comment on that?
Absolutely. I think far and away, that's one of the most rewarding parts of our job. We have our relationships with our patients, of course, but I work very closely with the medical assistant staff. They are my wing women throughout the day. They room our patients. They assist with procedures. They're helping me scribe. They send medicine. They're manning the phones, our online system. They are busy and they are whip smart, very talented, quick learners, and motivated. Most of our medical assistants either want to become PAs, physician assistants, or go on to medical school. And especially as someone who had a winding journey myself, I very much appreciate having the opportunity to work with them at their kind of early stages in their career development and mentoring them, encouraging them, and helping them figure out what they really want to do.
And we've invited them to participate in the PA training program that we've established. So they have an opportunity to add that to their resume. One thing I'd like to develop is helping them, say, write up a case report
Absolutely.
to add to their resume. Let them stand out above the crowd and the many resumes that come our way with newly minted physician assistants.
Correct. So it's just a joy every day. I think they help keep us young and hip, and they teach me about TikTok and
they show me how to use my iPhone. So that's helpful.
Yeah, they tell me when I'm using words incorrectly.
Oh, good.
Like slay,
Oh, yeah, that's wrong.
Riz.
Keeping us hip.
So, Dr. Rostan, what do you wish more people knew about your work as a dermatologist?
The message that I want to share is I'm not just making people look pretty. I'm finding things, I'm taking care of things, I'm increasing self-confidence. I'm taking an acne scar person that just really doesn't go out and bringing them out of their shell. There's so much more to it. We are healing people. And like I said earlier, we're making their skin healthier. The function and structure of their skin is healthier and important in my mind for good aging. Aging the way you want to age. I mean, none of us like wrinkles or sagging skin, and a little bit that's kind of a fact of life. But staying ahead of the game, it just makes people feel great, makes you feel good about going out with friends. And I mean friends at age 70, feeling good about it.
Absolutely. I think there's been a lot of studies that show that if you are feeling more confident in your skin, you're more likely to have success in your relationships. You're more likely to have a greater degree of career success. All of these things are very important.
Absolutely.
Yeah. And I think one thing I wish people knew about dermatology from my perspective is that a lot of times we can help. So I sometimes see people come in for skin cancer screening exams, and then I notice on their exam that they may have terribly uncontrolled dandruff or seborrheic dermatitis, or they've got eczema that they've had for many, many years, but they've just kind of given up on. We have great treatment options now that didn't necessarily exist 10, 15, 20 years ago. So if there is something that's nagging you, come in and we'll do what we can to help you. I'm spoiled now. My goal for my patients is clear skin.
Absolutely.
My goal is not that you just have one eczema patch or just your psoriasis is only on your elbows. My goal is that you are clear. And we now have the ability to achieve that in most of our patients.
That is great news. And I think a great way to sum up our chat today. We hope that all of y'all have learned a little bit more about what we do day to day and how much we love our jobs. I think that came through heavily. Thank you for participating in today's podcast.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.